Febrile seizures can be scary, but they are usually harmless. Knowing what to do can make all the difference. Hello everyone, I'm Dr. Sherif. I'm a German board-certified specialist of pediatrics. Febrile seizures are seizures that occur in children in association with fever, which is body temperature over 38.5 degrees Celsius, without any evidence of intracranial infections like meningitis or encephalitis, any metabolic disorders, or epilepsy. You need to understand it's a very common thing. It happens in about 2 to 5% of all children worldwide, which, if you think about it, is a very large number of children. The typical age of febrile seizures is between 6 months and 5 years old. Below and above that is very rare. You need to learn that without fever, it's not a febrile seizure. So one of the key factors is having fever, and the fever must be sharply defined here. Core body temperature over 38.5 degrees Celsius, typically during the rapid rise in temperature. The real reason for febrile seizures remains unknown, but here's the deal. Febrile seizures usually happen because of a sudden spike in body temperature. Not how high the fever is, but how fast it climbs. It's like your child's brain went, whoa, we were at a cozy 98.6 and now we're at a sauna level in 10 minutes. Time to short circuit a little. Causes? Classic culprits. Viral infections, ear infections, throat infections, and vaccines? Rarely, but yes, they can cause fevers. And guess what? The fever, not the vaccine itself. It can trigger the seizure. So don't side-eye the nurse. It's still safer than measles. Promise. Second cause, genetics. Yep, you can thank the family tree. If you or your siblings had febrile seizures as kids, chances are your little one's nervous system has the same drama queen wiring. Third cause, the brain's temporary short circuit. Young brains are still wiring themselves. So when the temp jumps, the electrical system can quote-unquote glitch for a minute. It looks scary, but the system reboots just fine. It's very important to understand both types of febrile seizures, as this will define the outcome and how to deal with them. There are two types of febrile seizures. Number one, simple. Number two, complex. A simple febrile seizure is characterized by, it is a generalized seizure. It's not focal. It means it includes the entire body. So the child has a fit all over their 4 extremities, not only one arm. Number two, it happens within the typical age group between 6 months and 5 years old. Number three, it lasts less than 15 minutes. Number four, it occurs once in a 24-hour period. But most importantly, the child may be unresponsive, as if they were unconscious. This means that if you speak to them, they do not react. Sometimes a child rolls their eyes upward so that only the white part of their eyes is visible. There may also be cyanosis, which is a bluish discoloration of the face and lips. Occasionally, they may bite on their teeth or bite their lips or tongue, leading to small wounds on the lips or tongue. In some cases, during febrile seizure, the child may urinate or defecate. As for complex febrile seizures, they could be focal, involving only one extremity, like one arm or one leg. Number two, they last more than 15 minutes. Number three, they could happen outside that typical age group, earlier than 6 months or older than 5 years of age. Number four, more than one febrile seizure happening in a 24-hour period. So how to deal with a child having a febrile seizure? First and foremost, you need to stay calm. I know seeing a child in a febrile seizure for the very first time could be terrifying, but you getting a panic attack wouldn't help your child or anybody. So please stay calm. Take a deep breath and act. Number one, ensure safety to protect the child during having the seizure. Number two, positioning. Place the child on their side, preferably on the left side, to prevent aspiration. That's what we call left lateral position. Number three, monitor the airway, breathing. Number four, take a look at the clock. You need to know how long does this febrile seizure last, because we need to know if it's a simple or a complex febrile seizure, and we also need to know how long does it take. If lasts longer than 5 minutes, you need to stop it using an emergency medication, which is diazepam rectal tube for children with body weight under 15 kilograms. Use a diazepam rectal with a dose of 5 milligrams. For children with body weight over 15 kilograms, use a diazepam rectal tube with a dose of 10 milligrams. Simply uncover their bottom as they lay down on their left side. Remove the cap of that tube, push the tube inside the rectal cavity, and press on the tube tube to release the medicament inside the rectal cavity. Keep pressing the tube on withdrawal from the rectum. This prevents the medication from coming back out. Diazepam is the trade name of benzodiazepine, which is the emergency medication in those cases that has a function to stop the febrile seizure. We use the emergency medication if the febrile seizure lasts longer than 3 minutes in Germany, and in the United States and other countries they let it run for 5 minutes. Technically, if you start moving to get the medication after 3 minutes of seizure, you're already back to the child with the medication. It's almost 5 minutes. Once your child has had one febrile seizure, starting at that point, you need to have the emergency medication everywhere you go. You leave that in the door of the refrigerator and you learn how to use it in case you have to. You leave also one of those medications there at school or at the kindergarten with your child's name labeled on it. That said, the teacher at school, the kindergarten teacher, they also need to learn how to use them. Try measuring the child's temperature, because remember, without fever, it's not a febrile seizure. It could be something else. If there is somebody next to you, let them pull out their phone and start filming the incidents. It will help us a lot as doctors when we see how your child was having a fit. Was it generalized or was it focal? How long did it last? We can see that through the video. So it's a ton of help to take a video after the seizure ends. Don't worry, your child will be really exhausted, as this belongs to what's so-called postictal state, which includes exhaustion because your child has been using a lot of energy during the seizure. They could be not 100% responding. They might throw out, urinate, or defecate, sometimes start crying. Slowly they will regain their consciousness and begin responding to you. We suggest that you call the emergency service ASAP, because you still don't know what's really happening with your child. Sometimes it's a simple febrile seizure, but some other times the child has had a seizure because they have a meningitis, and you cannot disclose if they have a meningitis or that was a simple febrile seizure. It's our job at the hospital to do that. We examine the child and see why they would have fever. We perform a full neurological examination to make sure there isn't any signs of meningitis like Borzinski sign, neck stiffness, and or encephalitis, which is a serious brain tissue inflammation that could be sometimes life-threatening. We draw a blood sample to make sure your child's inflammation parameters are not high, and in children under the age of 18 months, we draw a CSF sample. We perform a lumbar puncture to exclude meningitis. So our role as pediatricians is to reassure, educate, and avoid unnecessary testing. Is there any treatment that we should give the child after having a febrile seizure? No! Once it's stopped, then it's gone. We advise that every child with history of febrile seizure isn't allowed to have a fever up to 38.5 degrees Celsius, and the parents of that child need to have antipyretic medications all the time. At home, if you go out on a trip, once their temperature surpasses 38.5 degrees Celsius, you need to give them fever medication and take them at the next time point to the doctor or the ER to examine them, see why they're having fever in the first place. Remember, we only give one of 3 fever medications to the children: acetaminophen, ibuprofen, or novalgine, preferably one of the first 2 every 8 hours if needed. I've made an entire video about how to deal with child and baby fever. I'll leave the link down below in the description. So what is the outcome of febrile seizures? How is the prognosis? Simple febrile seizures have excellent prognosis. They do not leave any sequelae or damage to the child's brain, learning disabilities, or lifelong problems. Although about 1/3 of children with febrile seizures will have another febrile seizure somewhere. But here's the good news. Most kids outgrow them by the age 5. Luckily, these are the vast majority of children with febrile seizures. On the other hand, some children with complex febrile seizures would later on, after the age of 5 years, develop epilepsy. There is an increased risk, about 10 to 20%, of developing epilepsy if it was a complex febrile seizure. There is a positive family history of epilepsy. There are pre-existing neurological conditions or multiple febrile seizures before the age 1. And we only diagnose that via an EEG, which is electroencephalogram, and could eventually need a long-time therapy with anti-epileptic medication. We perform the EEG examination at least 24 hours after the fever is gone, because if you perform an EEG examination as a child having high fever, that would lead to inaccurate results. If you have any questions about febrile seizures, please leave them in the comments down below. If you found this helpful, give it a like and hit subscribe for more health tips. If you want us to discuss any topic concerning child's health, please leave your suggestion down below. below and I'll make a video about it. Thank you for watching. See you in the next one.